Okay, let's bring up Barby from the iPain. Yeah, this is where we dance. Okay, so, and she is the cheerleader of hope. Let's bring her on the stage. Welcome, Barby from iPain Foundation.
Hey, so glad to be here.
We are so happy to have you here. And I know I'm going to allow Estella to take over the conversation, but Brandy and I just want to say congratulations for the Fibromyalgia Legacy Award. Did it arrive in the mail, hopefully? No? Can people hear me? Am I okay?
Yeah,
we can hear you.
You said Brandy. Did you mean Barbie? Or
did
both?
I say? Barbie knows how this works because she's thrown a conference before. So, Barbie, congratulations on the Fibromyalgia Legacy Award. I'm going, there it is. Okay, so it did arrive. Did I say Brandy? Oh, okay. Yeah. So we're going to open up the stage for you and Estella to have a great conversation. I'm here. I'm just working backstage to make sure everything goes well for the conference. But it's NERVEmber, right?
It is.
So we're going to have a big celebration time with that. So I'm going to allow,
I just want to say real quick, hi, Barbie. We've never actually met before. So this is the first time that I've actually got to talk with you. So it's so nice to meet you in person. I follow all your stuff. I hear so many great things about you from Melissa and just across the internet. So it's such an honor to be able to finally meet you and say hello.
Absolutely. I'm excited to meet you as well. And I loved watching your daughter's reaction when you started sharing what she was actually eating in her smoothies. I was like, that is just so typical that they don't realize. And then they're like, hey, you tricked me. And it was good. Oh my goodness. So great way to get the kids to start having good eating habits right from the start. Love it.
Yeah, absolutely. Thank you. It was nice meeting you. You guys have fun.
Thanks.
Yeah, I'm glad. How rude of me not to introduce the two of you.
It's okay.
What a bad host. Okay. Well, we'll have fun and we'll be back shortly. And so everybody, if you're out there, we are live on the main stage. Tell all the people in the conversations out there in the exhibit area, in the reception area to come on in, because we're going to rally around all the work that's amazing advocacy work that's happening. You're going to learn a lot and you're going to get involved in the celebrations and festivities that are taking place. So we'll be right back. Enjoy.
Oh my goodness. It's great to see you. I'm rocking the orange.
Yay. I was like, orange is, I have to wear orange for NERVEmber, but I also was like, my niece made me this purple crown. And I was like, this is going to be perfect to be purple, my crown, my bracelet, my pin, and with the orange, of course.
That is amazing. It's always great to be here on stage with you. You know, we've been together this year in person already. So I got my Barbie fix already for the year. Right. Congratulations on the Fibromyalgia Legacy Award. I am so excited, just to have you here and to let us know a little bit more about you. So if you can please just start, Barbie, by letting people know who you are, the organization, like a brief bio for those that are tuning in that may not know. I'm sure everybody knows who Barbie is, but just
Well, there might be some. I do a lot of different things. So sometimes people see me or meet me or learn about me for one particular reason. And then they go, oh, wait, you do more? You do other things? So I have published 9 books. I work with over 150 different pain conditions, including fibromyalgia. And I don't have fibro myself, but it is basically a sister disease to reflex sympathetic dystrophy, which is the rare disease that I live with. So it is definitely something that I talk about a lot, share a lot, done a lot of research into, help with research studies to get patients into those studies, and really think that there needs to be more about fibromyalgia as well as RSD, reflex sympathetic dystrophy, known in the public as well as in the medical world. I also am currently the president of International Pain Foundation. This is my 10th year as president, and I'm actually hanging up my crown on that in December. And so there will be a new president of International Pain Foundation, but I'm going to stay involved, and I'm going to be able to spread my wings a little bit more and do a whole bunch of different advocacy work for different organizations, and spread my focus out a little bit more than just with iPain as my lead organization. I get to do a lot more work, and I'm excited about doing that. And I am also a chronic patient, as I mentioned, since 1996. I first developed endometriosis and then developed RSD in 2002. So it's been over 20 years, and I had to become my own advocate in my own healthcare, socially, and in the legislation world. So I wear many different hats and work on many different projects. And then on the side, I do modeling and and reality television and other fun projects that are just for me in my own mental health.
And pageants, right?
And pageants. Yes, I'm currently Mrs. Southwest Petite USA, and my real crown and sash are over there behind me. But yeah, I've been doing modeling and pageants since I was a child, and I took a 30-year hiatus. 20 years ago, I said, I'm going to do Mrs. Washington. And that same year, I developed RSD. My whole life fell apart. I was not able to compete in the pageant, let alone walk or work or any of those type of things. And I've had to rebuild my life. And this year, I turned 50 in 2 weeks. And I'm like, I got to do something for me. And I went back to my bucket list and said, what can I do? And did the pageant, and I'm so excited that I did, and that I did so well in the pageant, and I look forward to continuing my reign through the end of this year until I crown the new Southwest Petite Queen in April.
That is amazing. And she's a cheerleader of hope.
Yes.
And there's a lot of titles that she holds that she didn't mention, and also married to the amazing Ken. So there is a real Ken and a Barbie, and here is Barbie, right? Barbie, really quick, can you tell us a little bit about one thing that you're known for in NERVEmber?
Yes.
And can you tell us a little bit about NERVEmber, how it got started, what it is, how can we participate?
Absolutely. So NERVEmber is something I created on a plane ride from Washington, D.C. back to Arizona back in 2009. It was October. I was going out there for a medical appointment, and I got on the plane, and everything on the plane was pink. The blankets they were handing out, the pillows, the seat backs were all done in pink, and it was Pinktober everywhere. And I said, I have got to make the world orange for nerve pain awareness. And I asked the flight attendant for a piece of paper, and she gave me some napkins, and I started writing down my plans on plane napkins for the NERVEmber project. And I got off the plane almost 6 hours later, and I had a whole idea formulated, and I even had come up with the word NERVEmber, which nerve is nerve pain, and ember is the burning fire pain we feel when we have nerve pain conditions. And I said, when's the best time to do this? My birthday's in November. My anniversary's in November. Do I really want to do this in November? And I said, yeah, because we went with like Painuary. My husband and I, Ken and I, we talked about like, what could it be called? What should we do? And we came up with NERVEmber, and it just kind of felt good and stuck and went along with all of our goals to raise awareness and to get outside of our silo and have something that anybody can be a part of, like Pinktober for breast cancer. We want to paint the world orange, color it, use a pencil that is the color orange, whatever you want to do. Share orange, be orange, live orange, and teach people about what we're going through with that nerve pain so that they can understand that invisible symptom that we face.
Yes, and that is why I'm wearing orange, because this is the way I support and NERVEmber, and I will be putting out a post. So what can people do? Is there a specific hashtag that they could use? How do they support? How can they support NERVEmber?
NERVEmber, hashtag is NERVEmber. We make it really easy for people to participate using NERVEmber. And we like for you to post stories about yourself wearing orange, taking a picture. Maybe you're out taking a walk and you see orange flowers, anything that is orange and you're coming across it over the month of November. We want you to share it and give it that hashtag. If you're in the doctor's office and they happen to be wearing like orange face masks or have orange items up on the counter, snap those. Snap your everyday living, and every time you see orange, share it. And we also use Go Orange, because so many people in the community do orange in their own way. Some are like, I will never be caught dead wearing orange, but I can wear an orange bracelet, or I can hold up an orange flower, or get an orange megaphone. Anything that you can do that's orange is important, and then sharing why it's orange. We have 3 days of action this month. The first one is this coming Monday, where if you haven't worn orange yet this month, we encourage you, especially on Monday, the 7th of November, to wear orange. The 14th of November, we want you to share your journeys with nerve pain, no matter what condition you have. Most of the years we've done NERVEmber, we've concentrated on 60 different conditions, 2 a day. This year, we're just celebrating all of the 150 plus conditions, and whatever condition you have that has nerve pain, talk about it, share it. And on the 14th, give us your journey. And then on the 21st, we're asking people to share their special skill, talent, or gift with the rest of the community using hashtag NERVEmber. And so if you're a singer, share that. If you can dance, if you have a great organizing skill, if you have a special hidden talent that we don't get to know about or see. Like, I used to put my fist in my mouth. I first charged $1. Now I charge $0.25. I first charged $0.25. Now I charge $1. Inflation here. Whatever your special skill or talent is that can help you be rememberable. And when other people think about your condition, if it's fibromyalgia or any other condition, that they think, oh yeah, I know this patient. She could really sing. She lived with fibromyalgia. So I want to learn about it, and I want other people to learn about it, and we'll get people outside of our silos talking about it.
So the 7th is wear orange. Mm-hmm. The 14th is your talent. And the 21st is
your journey.
Oh, your journey, and the 21st, your talent. Yes. I want to go straight for the talent, right? Yes. Even if it's simply just putting on lipstick, orange lipstick, or orange nail polish, or whatever it is. I think, every little counts, and no matter what you do, the best thing to do here is to just share and raise awareness, because that's how we are louder, right? That's what Team Fibro is about. That's what we're talking about today.
We've absolutely worked around the world with the NERVEmber project. We've done balloon pops. You can still do a balloon pop and hashtag that iPain pop. And we've worked with the country of Uganda to set up NERVEmber Park in Uganda, and they provide free medical services for the patients that come into NERVEmber Park and get the training and care. And we've really enjoyed working with the government leaders in Uganda, and Josephine, who's been a Past Hero of Hope Award winner. And we've done this all over the world. We've lit up different landmarks and all kinds of things. We've done the I Give a Care Run Walk Roll during NERVEmber, which you've participated in. So whatever it is you can do in your community to talk and share with people who wouldn't normally hear the message, go out and share NERVEmber, and you can always lead them back to NERVEmber.org. If you don't know exactly what to say, you can go on to NERVEmber.org, see the history, find out the keywords and things to talk about, and share the project so that it keeps growing around the world.
Yes. And yes, Danielle, November 21st is Share Your Talent. That's what I kept going for. So yes.
You can share it before then, but especially share it on that day.
Right. But also you can go to the website. So if anyone has questions, so there's a lot of comments on the comments. So we'll have Melissa pop them up as we go through. So, please join the NERVEmber.org and the whole mission behind NERVEmber and Going Orange. So I know there's, like I said, you have so many things that you do, but you also do something very special where you highlight a lot of people and organizations and the stuff that you're doing in a magazine. So can you tell us a little bit about iPain magazine, iPain Living magazine, and just share, I don't know if you have one, you always have one handy there. But if you don't,
you're going to see my pajama pants probably, but
it's okay. I think we're all wearing pajama pants.
Okay.
It's about being comfortable, and it's about being here together today. So
yes. So we've been doing this magazine. We're working on our 8th year. We're starting our 8th year, and we have all different issues. Each one focuses on different conditions involving pain, and we have different celebrity guests on each of the covers. And we've had Jerry Mathers, one of my favorites, Paula, who lives with RSD. We have spotlighted fibromyalgia in many of the issues that we have put out, and the magazine actually has stories in it from patients, caregivers, and providers. So we try to have a wide approach to it, just like this conference is, having different people come on that are patients and caregivers and providers and industry researchers. We try to get a wide variety of stories and touch on a lot of different conditions, from Parkinson's, arachnoiditis, sarcoidosis, RSD. So we try to use the magazine to spread awareness, share about what's going on in all of our communities. And to me, it is, like you said, it's really important to share what we're doing as International Pain Foundation, but also share what other groups, organizations, and people are doing. A lot of times this year, I heard, well, you get to help write a bill because you're president of an organization. And so I'm stepping down, and after 10 years, I'm giving somebody else a chance to take on those leadership roles for the organization. But I'm going to show people, hey, I'm not going to have a title for at least the next 2 years with any particular organization. Watch me still go. Watch me still be active and involved and do the things that I'm doing, so that you can feel like, hey, even if I am doing this thing that feels small, that it matters in the community, and we can amplify each other's efforts, voices, and activities. Different things resonate with people differently. They need to hear everything that we all have to say. And as long as we're going forward in positivity and hope, then it's worth sharing. So I look forward to continuing sharing, but I also look forward to showing people that it can be done without a title too.
Yes. And you know what? And I'm glad that you mentioned that, because a lot of the speakers today, many of them don't have an organization, and they are patient advocates, and they didn't even know that they were patient advocates, but they hold the title because of the work that they do in their community, because they support one another, and because they're just here contributing, making a difference. And, I said it earlier, every patient matters, every story matters, and your voice will be heard, and we are louder when we're together. So that's the whole thing about this, is you don't need a nonprofit organization. You don't need to be president, vice president, or whatever. Your story is what makes a difference. And your story is what makes a change happen. And that's why we are here, because we want everyone to come together, feel empowered in this amazing community that we have. So Barby, it's really amazing. You have contributed to bills that not just affect you and your condition, but other conditions and other people in Arizona right now, where you're residing, but also everywhere else, because I know we are all very supportive of a lot of the stuff that you're doing. Can you tell, or can you share a little bit about the bill that was just passed because of your work and efforts?
Oh, well, thank you. I actually passed 2 this last legislative session, One is Arizona SB 1162. It's now law, and it allows chronic pain patients in the state of Arizona to get the care they need individually. It's up to the doctor. There's no more MME, we call it, equivalent to morphine. And there was a standard based on the national CDC guidelines that our state had passed a law saying that that was the cap on pain medication. And it wasn't supposed to be for chronic pain patients, but we got swept under the rug with that. And we passed that law that changed it to there's no MME anymore here in Arizona. It is what the doctor needs to prescribe for the patient to live the best life that they can. So that was the first one. And the second one is Arizona SB 1469, which also got passed into law. Both of the bills were totally unopposed. And SB 1469 makes it illegal for the law enforcement, federal, state, local, to look at the PDMP information about individuals. So it protects us when you think HIPAA would protect us, but it wasn't protecting us here in Arizona. And now law enforcement has to have a search warrant before they look at PDMP information, which not only protects the patient, but it also protects the providers here in Arizona. And we're just got implemented about a month and a half ago. They got implemented into law, and really excited about that. And I have 4 more bills that I've written personally that are going up to our legislature for vote. The bills will get dropped in January, and I'm really excited about the work that I have going on. And I'm a patient leading it. I'm not doing it as Barby International Pain Foundation president. I'm doing it as Barby Ingle patient, and I'm asking other patients and caregivers, as well as support group leaders and nonprofit organizations and industry, to come once the bill drops, to come in and support it and have their voice be heard, to show that these laws are needed and that they should be passed. And hopefully they'll get passed unanimously. I've spoken to a lot of legislators here in Arizona that are running for office on both sides and independents. And so no matter who's in office and whoever takes over for our health committees, as the new leaders of the health committees, I'm ready no matter who wins. It doesn't matter to me as long as they are supportive of the chronic pain community and get the help that we need so that we can keep our hope flowing. And I feel like I've done a really good job of reaching across all sides to, no matter who's in office, these bills will move forward.
Yes, and I think it's so important to know that even though we do spend some time, talking about these bills, it takes a lot of work, having these meetings, not only, in DC, but things happen in the community where you live. You're a constituent, and these legislators work for you. So that's the one thing I want to make sure everybody understands. You don't have to know a lot and have a lot of background in policy, even though maybe some of you do. You could just be supportive with whatever Barby is doing there in Arizona. She does reach out occasionally because it's always good to have more patient stories involved to be able to share the story and make that change so that policies are getting implemented that obviously are going to affect us in a positive way, because there's so many things that we are still struggling as patients, not just there in Arizona, but everywhere else. And a lot of times it's a lot easier to work on a bill at another state if it has already been passed in another state. So like in Arizona, the bills that are there, we can actually try and implement them and work on them individually in our states. So
absolutely. And remember that every state is a little bit different and your laws are different. So some states will need a law, like a PDMP law that requires a search warrant. Some states already have it. So make sure that you check into your state as to what it already has on the record in law and how you can best affect your state, especially when it comes to healthcare. There's federal bills passed and we work on those, and we've actually helped pass laws in Australia and Canada. But we also know that the healthcare bills, even though like for instance, the Newborn Screening Act, it passes federally, but then each state can decide how they want to implement those rules, and they can make it stricter or more lenient. And make sure you know what's going on in your state and then work to fix it. I did not know what I was doing. I just picked up the phone and started calling legislators and saying, I'm having trouble getting care. I'm having trouble getting a diagnosis. I'm having trouble getting access to treatments that my doctors thinks are right for me. And by doing that, it helped them. Before this past year, when I actually helped write a bill, it helped those legislators know that there's constituents in our communities that need help, that they can't really get the help. If they can't really help us if we don't know and reach out and teach them and share our stories with them as well. So please, please, please contact your state legislators. And if you don't like talking on the phone, which Ben Aarons earlier was talking about how phones were a trigger for him, they are also a trigger for me. So a lot of times I will call like after 5 p.m. and leave a voicemail. And so, just whatever you need to do to have your voice be heard, find a way to adapt what your triggers are or what works best for you into the situation to get done what you need to get done, that not only helps you get the care you need, but also helps the whole community get better care and better access to care.
Yes, and emails work. Phone calls work, Zoom meetings work, and then going in person and meeting with the representatives work too. We are actually also working on all copays count here in California. Yes. So if anybody has a story about using copay cards or not being able to use the copay cards, please let us know, because we can use your story, share your story, and make a little shift here in California as well. Well, Barby, is there anything else that you would like to talk about? Like, I know one of the things that I wanted to ask you, and I know it's, just kind of throwing it out there because I love Ken and I know that he does so much for you, but can you tell us, because you guys support the caregivers, you guys represent the caregivers as well. That's one of the things that we have always been supportive of here at Looms for Lupus, is we incorporate a lot of support for the caregivers, the loved ones and friends of those living with conditions, because we know how it impacts not just the individual, but their loved ones as well. Can you talk a little bit about caregivers and the support from Ken and what you guys do there at iPain?
Yeah. So as you said, Ken's my husband and caregiver, and he is in the Best Husband Club. And without our caregivers, we wouldn't be able to function and do the things that we do. We need that support. And we also need to take the time to recognize that our caregivers need hope. They also need their own time. He is there to support me and do all the things that I physically need. I say he's the physical, I'm the mental, but he does a lot of mental stuff too. And to be able to say he goes through every single thing that I do. And that's the thing. People don't realize that caregivers are going through a parallel journey with you. And they may not physically have the same symptoms, but they're going through the emotional aspects, the financial aspects, the social aspects that we are going through as patients. Give them a break. Recognize that caregivers need to also have a break. This is also Caregiver Awareness Month. So Ken does a lot for caregivers, and he actually works with Johnson & Johnson on their caregiver program that I can't think of the name of right now, but he's Generation Care. He works with Generation Care, which is also a hashtag you guys can look up. And know that the caregiver should also have a voice. For me, Ken goes to my medical appointments with me. He's there to be that objective voice in the room, to support me and be my cheerleader in those times. And when you're looking for a caregiver, make sure that you're bringing the type of caregiver that can be a cheerleader with you to those appointments, not the one that goes, I didn't see you fall down, but that says, yeah, if this person is saying they fell down, even if I didn't witness it, I know that they have balance and coordination issues, that this could have happened. Be there to be their supporter, their cheerleader, and to the patients, know that your caregivers are putting in what they can give. And if there's a time where they are not able to fulfill something that you need, don't take it out on them. try to pump them up and show them the love and respect that they're showing you as the patient. Turn that back around, be a mirror, and let them know that you appreciate what they're doing, and that you know that caregivers need that support mentally, physically, and emotionally as well. So Ken kind of does the mentoring on the caregiver side, and we have other caregivers that step up and help as well. But it's really important that we incorporate the other people in our life and bring them to our table, as Crystal talked about this morning. We have a table, and if someone doesn't invite me to their table, I'm like, that's okay. I'll make a table and invite them. Same as her. So make sure that we're, making tables that can connect to each other. So at Thanksgiving, we all can be thankful for what each other are doing and boosting and helping the community and lifting each other up. And Ken does that for me. So thank you for letting me talk about him a little bit.
Yes, we can't have a conversation without talking about the loved ones. So, caregivers do play a huge role. So shout out to all the caregivers, loved ones, friends, and those that support those living with these conditions, and there are many conditions we may be living with, and maybe some of them are visible, some of them are invisible. But the good thing is that, we are supporting one another. So I'm just, happy that you were able to share that, because your chemistry with him, it's just, you can see the love and the support, and I love it. And I love the fact that he's also very supportive with others, and he shares a journey, and he's your co-pilot for a lot of the things that we see and that we see you do. So I love that very much. And if he would be here, he'd be wearing orange, matching your outfit.
He was wearing orange. He's not here. We are in the middle of a move in NERVEmber, and his mom is actually moving in with us. So we have a lot going on right now, and so he couldn't be here for this minute. But he has been coming in and out and listening throughout the day as I'm sitting here listening and watching. So if he was here, he is in orange, and we both have our support fiber bracelets on as well. So we're dual supporting each other.
Right. Love that. Yes. So is there anything else that you, projects that you're working on currently, anything that you want to give us, any information on that you're currently working on?
Oh, I think the biggest thing is transitioning and turning everything over to a new board of directors for International Pain Foundation, and then continuing to do projects. I am working on another book, a 10th book that my brother asked me to do that should be out in 2023. And then the 4 new pieces of legislation that I've written that I mentioned, and constantly working on. I coordinate all of the editorial for the iPain Living magazine. So I'm constantly looking for stories, poems, anything that can boost and promote the pain community. So if you're interested in any of that, you can go to internationalpain.org. If you're interested in me, my journey, and what a patient advocate is doing, you can go to barbyingle.com, and maybe that will spark some ideas in you so that you can say, hey, I like that idea. I can do this or that. One of the bills I'm working on is here in Arizona, we have a red cap law. So all opiates that are sold have to have a red cap. I'm working on a bill to abolish the red caps. And in meeting with my legislator that's probably going to be dropping the bill, she said, hey, let's get a whole bunch of red caps and make them into jewelry like necklaces and bracelets. And when we come to testify, we'll all be donned in our red cap jewelry.
That's an awesome idea.
So we're going to get creative and crafty like you guys got this morning, and make some bracelets and necklaces. Patients here in Arizona and caregivers here in Arizona are going to be putting those together, so they'll be ready to go in January. And so get crafty in the way that you present to your legislators, and make it something that's memorable and can continue on. And they go, oh, remember when all those people showed up with that red cap jewelry? It just make it fun and interesting, get crafty and creative, and do it with your loved ones, your caregivers, your family and friends, so that other people are in that experience with you, and it makes it more meaningful for everybody to promote it and share it.
Yes. Do you have an event coming up this year?
Yes, I do. We have the International Pain Summit, which we've been doing since 2007 was our first one. This year it is a one-day event. We've done anywhere between 1 and 3 days. This year's one day live on Facebook. It's free to attend. And that's NERVEmber 15th. And then on November 17th, we are doing our first in-person event since COVID happened, since we held our International Pain Summit and Comic Pain Relief in 2019, right before the whole world shut down. We are doing Comic Pain Relief in person on the 17th of November. So we're going to be doing that. And then in December, we're going to do a meetup at Disney World.
Wow. Okay. I wish I could go to that one. Well, I wish I could go to all of them. We're going to be at the American College of Rheumatology conference on the 15th, but it ends that day. So we are going to be joining.
Awesome.
Yes. The good thing is it's going to be virtual. It's on Facebook, right? So we will all be able to share. So if you can follow the links, I think, Barby, if you can later on when we're done, just put it on the Hop-In Live, just type in the links to your Facebook page, unless you have a booth. I don't remember. Do you have a booth?
Not that I know of,
Okay.
but I will drop the links or make sure they get dropped and let everybody know about them so that you guys can participate. It's free, and it will be similar to this conference, fun but educational, and very, very
We're always
social.
having fun. We're always having fun,
right? It's a lot of times you go to some educational events in the pain world, and it's not so fun, or it's just straight education. And to be here today and be a part of it, just as a viewer watching until I got to go live with you, it was like, wow, this is fun. Oh, this is so interesting. I'm taking notes on little stickies and writing them down. And earlier I wrote down for I don't know if Ben Aarons was a doctor or not, but all I wrote down was ring trigger, or I wrote down ringing phone. And I'm like, What is ringing phone? Did the phone ring while I was trying to take notes? And then I was like, no, he was talking about how it's a trigger for him. And it's such a trigger for me that I had to go back in my mind because I blocked it, because phones ringing is a trigger for me. Because when my dad died, I got a phone call in the middle of the night, and now I was never afraid of phones before that. Now, every time the phone rings, I think someone's calling to tell me that somebody died. And it's a trigger. So having him talk and share this morning was great for me. But it was educational, but also fun. And, there's been so many great presenters today. So I really appreciate it.
We have laughed, we have cried, and we had music bringing you on. So everything brings us smiles. With Brandy. Brandy said that she also has a house phone, a landline. So she's happy to see someone else does. I know my mom does. She actually had it disconnected and then got it back because, of the messages. We all, are, as caregivers, we want to know what messages she's being left, review them, and making sure that, Melissa says that hers rang earlier too. It's amazing to see. And thank you, Crystal. She put the link. She put the link up there. So
thank you, Crystal. And I'll tell you, this is a public service announcement real quick. So if my dad had a landline, the night that he passed away, he normally had one. It had gotten accidentally cut from construction workers on the house next to him. He tried to call 911 and he could not speak. And his landline was cut off. He tried to use his cell phone. He couldn't speak. They could not triangulate him. And he passed away. And he would not have passed away, or at that time, had he had a landline. It is so important that people have a landline, because until 2025, cell phones are not mandatory to know, and even VoIP phones are not mandatory for the fire department to be able to find you. And just this past November, Ken's father passed away. And he was on the phone with Ken, and Ken was talking to him, teaching him, like not teaching him how to breathe, but he was having trouble breathing. And so Ken was counting for him and trying to get him to get oxygen. And I was on the phone with 911 as we were driving to his house. He did not have a landline either. And the 911 people kept saying, please keep repeating the address because your cell phone is breaking up. And I had a voice and they couldn't hear me. And I was having to repeat the address. We got to his house before 911, before the ambulance and fire trucks got to his house. He ended up passing away. But being able to talk on a clear landline where they know where you are calling from is very, very important. So PSA for everybody, please think about getting a landline re-put back into your house, even if you only pay for $9.99 a month, $9.99 a month, so that you can have that 911 service.
Yes, no, I love that you're sharing that because it is so important. But I also, what I heard is that as long as you have a phone and if you still have a jack, you can actually make 911 calls that way. And you can,
if the line is hooked to a telephone pole.
Yes, as long as the construction workers don't cut the line. Right. So I think it's a good thing to give that tip, because this is about sharing and sharing what impacts us in our stories, and sharing our stories and making an impact on others. And thank you for sharing that. And I'm sorry for your loss and for the loss of both of your parents, and in such tragic ways too, where the phone could have been so helpful in this cases, and perhaps life-changing and life-saving. So, I may have to I have the jack and I have the phone just in case, but I think I may have to now get a landline back on. It's worth $10.
It is. It absolutely is. And it literally can save a life of someone you love. So consider it.
Yeah, Crystal is just post. She said, if we only could text 911 dispatchers, if we don't have, I think there you go, the message she put. Yes, because they can actually track from a landline where you're calling from, and it's a lot easier. And that way, if you have a phone, you have a cell phone, and if it disconnects or whatever, you don't have good service, you at least have a landline. That's a little bit better. So, this is the great information. Thank you for sharing, Barbie. That's such a personal story. Anytime I talk about my dad, my heart breaks for any dad story, that I hear, because they just, they're the world to us. And I know it was impactful to you. And
thank you. And my dad was the one who helped start iPain, and he was the first president for 8 years. And then it's been 10 for me. So now it's on to somebody else who probably won't be a blood related family member, but I'm excited to have iPain keep growing and going on.
Yes, and I'm sure he's looking down and feeling so proud of you and proud of everything that iPain has done, the magazines, the bills, the support for the caregivers, for these little shout outs, this PSA that you just gave that could be probably saving lives, to others. So to me, I think it's such an honor to actually be here interviewing you and highlighting a lot of your accomplishments. From the day that I first saw you, I really didn't think you guys were real, and you guys are beyond real. And I think the reason why I thought you guys were not real was because of the name Barbie and Ken. But once we get to know everything that you guys are doing, we are, it's just amazing to see how real and honest and just giving you guys are to not just one specific community, but the community as a whole. So I love working with you. I love seeing you. I love connecting with you and cheering you on, because I know you always are cheering everyone else. So I would put my pom-poms if I had some here, and I'd be cheerleading some routine. So thank you again. We have a couple of minutes. I don't know if you want to come on, Melissa, and maybe go over a couple of questions or comments that people have been putting on. I have been trying to follow them. I couldn't follow all of them, but it'd be great if you highlight a couple.
Well, we have a huge rally around everyone, and I want to get in on the group hug because of all the amazing love and heart I'm hearing here. And the event in November, the comedy, that's in Phoenix in person, right?
It's in Phoenix in person, yes. I will try to live stream as much of it as I can on our Facebook page, but the comedian is proprietary, so he doesn't allow video. But before that, we have our Hero of Hope Awards and some presentations, so I'll try to live stream that portion of it.
Well, fantastic. And you never know who might be surprising you there, depending on if I can get off the plane in time. You know, because we're coming from ACR. So let's move the plane. Maybe I could get a pilot's license. Ken has a pilot's drone license.
It's going to be at the event.
Okay. Well, and Amy says, thank you very much, Barbie. I'm in Arizona and I greatly appreciate the work in this area. So everybody is rallying around you and giving you shout outs, Barbie. Thank you so much for joining us here at the conference today.
You're welcome. Thank you to everybody who is doing anything to help the fibro community and the pain community so that we all live better lives. Everything counts. So keep going, keep doing it.
Thank you. And thank you, Estella, for helping moderate the panel I know Barbie inspired me with a conference setup. So hopefully we can do this.
You guys are doing awesome.
Yes. Yes. Kudos, Melissa. You have been amazing. This whole conference, the tech, everything, collaboration, getting us all together. Like this hasn't happened in a while. We've been together for the iPain Summit, many of us, but we brought in a lot more people this time and we're all sharing the same stage right now. So it's amazing to see that what you've done with iPain and the iPain Summit, Barbie, now it's coming over and we're doing it in the fibromyalgia community. So
take the palms.
That's what it's about, right? Pom-poms. That's what we need, a new emoji. Pom-poms.
I know I was trying to heart everything. So, but what do we'll have to talk about this later because I know we have our next guest waiting in the backstage, but what do nerds use for pom-poms?
You just go like this. It's like shaking the palms. That's what you're doing without the palms. But if you're not a nerd, you can just grab the palms.
Okay, so cheerleaders and nerds unite here at the Fibromyalgia Community Conference. I love it. We're bringing everybody together. So anything that happened in high school stayed in high school, and now we're moving forward, and nerds and cheerleaders work together on the live stage. So,
yes, and smoothies and connecting through smoothies. We have a couple of great recipes as well. So I will see you guys all. So you can invite your next guest. Thank you, Barbie. Hugs and kisses to Ken and Brandy and your kids and everyone else. We'll see you guys a little bit later.
Bye. Thank you.